All right, so let's get started. To get started, I want to introduce our panelists, and I will introduce myself first. I'm Jamie Hintz. I'm a policy specialist with Foster Club in Washington, D.C. I spent about 8 years in Oregon's foster care system, and while I was transitioning out, I stumbled upon Foster Club, and I've participated with Foster Club on multiple activities. And then I started working for Foster Club about 2 years ago. So my main purpose with Foster Club in Washington, D.C. is to educate foster youth and alum all across the country about child welfare policy and get their feedback and responses, and then report all of that back to federal policymakers and members of Congress so that they can make decisions that are informed by the perspectives of foster youth and alum. So I also report all of that back to our community of foster youth and alum about all the conversations going on here in federal child welfare policy. And this webinar is one way that I like to do that. So finally, I encourage all foster youth and alum to advocate in policy. And I also share tips and information on specific actions you all can take and that anybody can take in order to improve the system. So presenting with me today is Demetrius Hicks. He's a foster club member for many years now. And Chris O'Grady, she's a member of our National Foster Youth and Alumni Policy Council. And Demetrius, would you like to introduce yourself?
Hi everyone, I hope everyone's all was well. My name is Demetrius Hicks. I am an advocate for foster youth. I spent 5 years in the Indiana foster care system, and I've been advocating to improve the system for the last 3 years. Most of my advocacy is in Indiana. However, I started working on federal child welfare policy with Foster Club about the last 2 years. Today, I wanted to share my perspective of the Family First Act and some examples of how the Family First Act would have benefited me while I was in care, along with examples of how you can get involved and take actions now.
Perfect. Thanks, Demetrius. So Chris will be joining us in about 20 minutes. She is on the line right now, but she will introduce herself in about 20 minutes when she starts talking about congregate care. So Chris and Demetrius will both be helping us apply the Family First Act to figure out how we can easily learn how these different policy issues will impact our lives. And I think with that, I think we should just get started with objectives for this webinar. So we hope to help you understand the Family First Act inside out. We want to offer you all the information that you need to make an informed and educated decision regarding your views towards the Family First Act. And for these reasons, we created this webinar to educate you about the provisions in the Act and to provide ample discussion time allowing you to ask any questions you may have regarding the proposed legislation. So Demetrius, do you want to talk about the application question?
Sure. I want to first start by saying policy can be a little bit complicated to understand simply because of the different language. It's not a common language. We use terms such as legislation, senate, and financing, and a variety of other different terms that we would not normally use. However, I do want you to understand that policy is somewhat to understand if we apply our own experience when tackling these policy issues at hand. Um, so today, I encourage everyone to write a simple question down to ask yourself as you go along and try to affect change through policy in your own way. And that question is, how would my experience have been different if the Family First Act was a law when I was in care? And our goal by the end of this webinar is that we hope that you are able to answer that question, and we also want to encourage you to share your feedback and what you've learned today from the webinar.
Perfect. Thanks, Demetrius.
No problem.
All right. So let's just get going on this. So the Family First Act is proposed legislation that would significantly change the foster care system, right? And we're going to find out how. So there are two major parts, and those are called titles within the Family First Act. And we will explore the goals of these titles and the policy changes proposed in each of these titles. And you might be asking yourself, what is proposed legislation? Well, the Family First Act is not a federal law, nor is it a bill currently floating through Congress yet. Once senators and House members identify a problem that they want to work on, they start drafting legislation. And our senators wanted to improve the foster care system. And after they heard from all of you and all the foster youth advocates out there about their experiences and their perspectives, the senators worked really hard to draft this Family First Act to try and address those concerns. So they have not introduced this bill to Congress yet. And once they do, that's when the formal voting process will begin. Since they have not yet introduced the legislation, there is not an official draft out yet. So federal legislation is still considered as a draft even after it is introduced, because there is still time to adjust or change the provisions even after it's introduced. So the time to address concerns in legislation, any legislation, is after a bill has been introduced into Congress. But right now, the choice among the Senate is whether or not to introduce this bill. So some senators might want to add to the bill, so they might want to introduce it so that they can add to it after it's introduced. Other senators might not like anything in the bill, or they might hear from their constituents that they don't like the bill, so they will decide not to introduce it. So it's important for you as a constituent to understand where this bill is so that you know what you want your member of Congress to do about it. All right. So Title I is all about prevention. Why prevention? Well, let's look at these national trends. The average number of children entering foster care every year is 256,000, and that's just children entering foster care every year. And then the average percentage of children entering for a reason other than a safety concern is between 60 and 80%. It ranges from state to state and jurisdiction to jurisdiction. But those are pretty high numbers for children that are being removed for other reasons than a safety concern. And foster care is really meant to be a place for children who cannot safely remain at home. So that means that an estimated 185,600 youth do not need to enter foster care every year. And so that's a pretty high number if you think about it. And so what does this tell us? This tells us that the system is becoming overwhelmed with children whose families could have stayed together if they had access to services other than foster care, right? And so a lot of policymakers and advocates believe that the reason the foster care system is so broken is because of the overwhelming number of children in the system and the lack of funding to appropriately serve each foster youth with the quality experience that they deserve, right? The quality experience and the quality services. So we're going to talk a little bit about that funding piece, because this is where it gets a little hinky, right? So public policy is all about how things are funded. And child welfare is no different. So federal child welfare policy is all about how the federal government finances foster care, right? So our current structure of funding has not changed at all. It's always been the same way. The Family First Act is actually proposing a significant change to our funding structure of child welfare, which is why this act could significantly change the foster care system. So I'm going to walk you through the funding structure and the proposed changes to the structure by the Family First Act so you can understand how this will change foster care. So we're going to actually do it by giving you a couple different examples and walking you through these case examples, right? So we have three different examples. So we have an alcoholic parent. Perhaps they end up in the hospital and the child is with them, and the hospital social worker notices and calls child welfare because this child has an alcoholic parent so severe that the parent ends up in the hospital. And so this family's situation comes to the attention of child welfare. Another situation could be that you have a teen who's getting into trouble with the law, and the police are know them by name and start exploring their family situation, and the police feel that it's right to call child welfare. So that's another situation that could happen. And then finally, a school teacher might notice that one of their students is living in a car and is living in the car with their family. So that family is homeless. And so the educator, the teacher, calls child welfare. So these are three examples of ways that a family's situation could come to the attention of child welfare, right? So, what's next? Well, we need to identify what the issue is, right? And so these families need services. So, our first family needs, some sort of parent and home skill based training, probably, or maybe substance abuse prevention or substance abuse rehabilitation services. Our second family could probably have benefited from family therapy or also parent education or parent skills based training or anything to address what the teen's behavior issues are all about. And in our final example, service that that family could have used would have been emergency housing because that family was experiencing homeless at that time, right? So, since there's no funding for these services, the Child Welfare Agency decides that the child needs to go into foster care. And once the child enters foster care, they are now eligible for all of these services, right? And they're only eligible for these services while they're in foster care, right? So, this is telling us that funding kicks in after a child enters the foster care system. And these are different examples of services that they are eligible for. And then let's say they get some services and then they end up, reunifying with their family, or which over half of foster youth actually reunify with their families. About a third or a little under a third end up aging out. So that could be a situation there too, or a couple might be adopted. But either way, the child officially leaves foster care through one of those routes. And then there's all these service opportunities afterwards. We like to call them post permanency services, but these are not federally funded either. So the only services that we're seeing that are funded are when the child is in foster care. But if the child is not in foster care, there's a really shortage of services that are available for the foster child. But you know, the Family First Act noticed this, and the Family First Act provides this new idea: provide funding for services before the child enters foster care, so that the family is supported throughout their current situations. Right. So provide services in this blue area on the screen, so that families can actually heal and receive a service that they actually need. Like foster care, not everybody needs foster care as a service. So this way, a child would actually not have to experience the heartache of entering foster care. So you can think about our examples here: our parents suffering from substance abuse, our teen getting in trouble with the police, or even our student who's experiencing homelessness with their family. And you can think about their situations to try and get an idea of how the Family First Act would have helped their family by providing them access to these needed services. Or you can even think about your own experience with entering foster care and think about the reasons in your own family situation and see if your family would have benefited from any services before you entered foster care. And think about what would have happened if your family did get those services that you guys needed. So I know that's really heavy and that's very policy. That's a lot of policy talk. But Demetrius is going to help us out and help us kind of connect the dots.
Thanks, Jamie. I want to first by sharing with everyone how the Family First Act would have benefited me directly if when I was in care, had this been a law. I entered foster care when I was 14. I was not discharged from foster care until I was 18 years old. As you can imagine, it is extremely difficult as a teenager to not only be removed from your home, but to be placed in a complete stranger's home. Um, And while I was in foster care, I found that not every family I lived with was as kind or as gentle to me as I expected, which just made my stay in foster care extremely hard. Um, but for me, the most challenging aspect of being in state foster care was seeing my grandmother desperately try and get custody of me and for me to live with her, and was constantly being denied due to inadequate services or lack of funding for kinship. And as a result, I was placed in traditional foster care until an adult. And as I look back, I realized that had the Family First Act been a law while I was in foster care, I would have it would have ensured that I was able to have kinship placement with my grandmother instead of a traditional out-of-home foster placement. And I would have also been able to maintain my ties with family members and relatives that I no longer have now as a young adult. Um, as a young adult. So now we've talked about Title One a little bit, and you've heard some examples from Jamie and I kind of want to receive some feedback from everyone. So, what are your thoughts, questions, or concerns? Feel free to raise your hand through the webinar so Jamie can identify you and honor your question.
Let's see. So while questions are starting to come in, I'll start us out for this one with a question I got earlier. And the question is, how are prevention provisions in Title I similar to the alternative response or differential response? And so a lot of you are probably working on alternative response and differential response in your jurisdictions and states. And this is a very popular approach used in many states and jurisdictions in an effort to prevent the need for foster care. And the Family First Act would make it a lot easier for states and jurisdictions to use AR and DR as part of their prevention plans, right? So this would allow alternative or differential responses to serve more families, since the Family First Act opens up the funding stream so that states and jurisdictions can have access to resources that alternative response and differential response models suggest. So alternative that is to say, just a little bit of background on alternative response or differential response. Those are models that assess families for services they might need other than foster care, and it's more of a referral type of thing. And then the Family First Act would actually say, okay, you've referred or you've assessed these families for these services and thus referred them. So now we're going to provide the support, the financial support to actually connect these families with these services so that they can actually get these services. Let's.
Good point. Good point, Jamie.
So we have a question coming in from Ollie. With youth that are 16 or older, will youth and child welfare professionals be mandated to make all available efforts to reunite the youth with their kin, as well as with youth being able to receive education and training vouchers and other foster care scholarships? So let me reread this because I think there's two questions in here. Will youth and child welfare be mandated to make? So there's a lot of, this is a really good question, Ollie. So there's a lot of provisions in Family First Act that have to do with kinship care, and this is actually a very big thing for Senator Ron Wyden, one of the authors of the draft legislation. He's very, very, very keen on kinship care, and so this actually started out as a kinship bill. And so there's a lot of stuff in there that supports keeping children with first keeping kids with their families, right? And then if they can't stay with their families, then the next best option is a kinship placement. And when we say kinship, we mean, aunts, uncles, close cousins that are old enough to care for kids, or grandparents, or anybody within the youth's family, right? And then, so a lot of these services that we're talking about are meant to support that kind of placement as well. I'm not sure the Educational and Training Voucher, or ATV, and foster care scholarships, that has to do with the transition to adulthood. So this foster Families First Act does not impact the ETV. It doesn't change the ETV or CHAFE in any way. So foster youth will still be able to receive those what are they called, supports, if they're 16 while they're in foster care and still eligible for those types of scholarships. Let me check the attendees to see if anybody's raising their hand. Okay. And just a reminder, folks, on the webinar, you are free to raise your hand if you'd like and ask a question, make a comment, raise a concern. If you raise your hand, I will unmute you so that you can talk to us, or you can type in a question. You can type it directly to me. You can type it to the group, or same goes for the chat. Okay. Well, I think now is time for Chris to introduce herself, because Chris is going to start us off with Title II, and I need to find her on the attendees list to unmute her. Here we go. Chris, are you there?
Hi, everyone.
There she is. All right, Chris, take it away.
Hi, my name is Chris O'Grady, and I am the member of the National Policy Council. And I was in foster care for 3 years in the state of New Jersey. And now I work on a lot of policy initiatives that have to do with foster care and prevention services. So what we're going to do right now is talk about Title II of the Family First Act. And I'm going to share Title II with you. The Family First Act applies to all types of foster care, including congregate care. Congregate care is a placement type meant only for children who need to receive specific services that they cannot access in any other placement type. Experts in Congress discovered that too many children were being placed in congregate care who didn't actually need to be placed in congregate care and who needed the services. And they found that there is no oversight of congregate care facilities to make sure that the children are safe and receiving quality services. In every state this differs. Some states do have some sort of oversight, but overall, a lot of youth were being placed in congregate care placements and then being left there for years. And there was no follow-up services or family finding services that were being done for that youth, and they were really lingering in those placements. And in most places, congregate care facilities don't have a lot of access to programs for youth and young adults, and they aren't able to engage in many after-school activities or education in the same way that you can engage if you're in a foster family placement or in a kinship placement. So a lot of people have been a little bit confused and think that Title II eliminates all congregate care placements, but this isn't true. This does not mean that all congregate care settings will be eliminated, but instead this title makes states show that youth need to be placed there. So it creates an incentive for states and social workers and organizations to find other placements for youth that don't need to be in these specialized placements. So that means if a youth has family and they actually want to live with those family and that's a good family placement, this incentivizes the state to find that family, even if it takes a few weeks of making phone calls or getting that family certified. And the federal government really wants to make sure that states and social workers are going that extra mile for the youth. And that if the state or social worker can't find those services, then they'll be placed in these congregate care facilities, or they'll receive extra mental health services somewhere else. So it's really an incentive program. This is not eliminating all congregate care placements.
Great. Did you want me to start this one off, or do you want to start this one off?
Oh, I can start this one off.
Okay.
So Title II, and the provisions of Title II of the Family First Act address the poor quality congregate care settings like residential treatment centers and group homes. Many foster youth have elevated the issues they faced while in a group home, and the Family First Act proposes more oversight of these facilities so that foster youth can have better experiences if placed in congregate care. So one of those negative experiences might be negative experiences with staff and sexual harassment, and that had been going on for a really long time and no one was paying attention. So youth went to Congress and say, hey, look, this is what happens in this congregate care facility, and we need more oversight, and I wish that this didn't happen to me, and I think if I was in another placement, this wouldn't have happened to me. And the federal government listened and said, okay, all right, so let's write the Family First Act and make sure that there's more oversight for these places so sexual harassment doesn't occur, and let's also incentivize youth to be placed with families so they're not placed in these congregate care facilities. Quality residential treatment programs are defined as clinically recognized treatment models, which is determined necessary for a child based on an assessment by a qualified trained professional or licensed clinician that indicates clinical medical necessity for treatment. So that is a big definition of what a quality residential treatment program is, and I'm going to have Jamie break that definition down for you.
Yeah, so I included this definition not on the slide, but in our notes, just because a lot of people are wondering, is what a lot of people are basically wondering what's going on with congregate care in the Family First Act. And so I thought, Chris, you did a wonderful job explaining like how these issues in congregate care settings reach the surface. And you're absolutely right. Federal funding for congregate care definitely, it does not eliminate congregate care. It actually improves congregate care because a lot of foster youth, as you said, were saying, hey, being abused, I am being neglected, I'm not getting the services that I need. And members of Congress were like, well, why were you even placed there if you didn't need the services? Congregate care is supposed to be a place where you get services because you can't get them anywhere else. So they worked really hard on putting together, on learning, from foster youth, what makes a good congregate care setting. So they heard from all kinds of foster youth about what they liked in congregate care settings, and they used this information to form these criteria for congregate care settings that they are willing to fund. The federal government in the Family First Act would be willing to fund congregate care settings that meet these four different areas that foster youth actually all spoke to. So foster youth said, I actually liked a smaller congregate care setting. So a home with, about 6 or fewer foster kids. And then others said, I didn't care about the size. I liked when I had a meaningful relationship with either other siblings in the setting or with my service provider in the setting or, different types of supportive adults. And then also the youth who were parenting or a youth who was an expecting parent, like a teen parent, they said that they actually got better services in congregate care than they did in a family foster home. And then foster youth with different kinds of disabilities, like maybe a learning disability or a physical disability, they also said the same thing. So they listened to all the foster youth say the good things and the bad things. And so they said, okay, we'll fund all the good things and we won't fund the bad things anymore. And so they also said we'll fund quality residential treatment programs. So that's basically saying if the congregate care setting does not provide the treatment that we say that they must provide, like the treatment that foster youth need, and it has to be quality, it has to be proven to work, then there's no reason a child needs to be in that congregate care setting, so we're not going to pay for it. So, and that's kind of that makes sense to me. And if you guys have any questions about that, it does get complicated, and this is why we're doing this webinar, so you can ask, if you want me to break down that definition. further, I'm definitely happy to. And finally, there were a lot of young people out here in Washington, D.C., who were concerned about independent living services and those who were living in congregate care facilities and getting independent living services while they were living there. It spoke volumes about those settings. And so the federal government in the Family First Act is now saying, okay, if you provide an independent living service, we will give you money to help you out, to help you provide that service. So let me just double check my notes to make sure I covered everything there. So next, Chris, I'm just going to hand this over to you.
All right, so how would a foster youth experience been different if the Family First Act was a law when we were in care? Well, I've worked with a lot of different foster youth over the years and have heard a lot of different stories. And so there's one person that I know in particular that I picked out this story to share with you today because it really embodies why we need the Family First Act. I knew a foster youth who switched homes 3 times, and 2 of those times were at her own request. She requested to move again, but her caseworker did not want her to move. The problem with her situation was that there were not any other foster homes in her school district, and she didn't want to switch schools as a 16-year-old. She ended up being placed in a residential treatment center that was in her school district just so that she didn't have to change schools. And this treatment center was actually meant for teen girls with behavior issues who were eventually going to reunify with their biological families. This foster youth was the only one coming in from a family foster home with a transition plan instead of a reunification plan. So she had no family to complete the treatment or family therapy that was required as a resident in that treatment facility. And she was consistently punished and treated like the other girls in the program who had behavior issues. She definitely didn't, and knowing this person, she is definitely a goody two-shoes and a complete nerd. But even though the only behavior issue she had was advocating for herself and requesting to be moved from a foster home into this placement so that she could remain in her school of origin. If the Family First Act had been a law when she was in foster care, she would have never been inappropriately placed in this residential treatment center.
Thank you, Chris.
So, thoughts. Now that you've learned about the Family First Act and Title II and heard some examples about how this could change foster care significantly, what are your thoughts? Do you have any questions, concerns? Feel free to raise your hand through the webinar if you'd like to speak, or if you want to type a question in the chat box, Jamie can read it and shout it out.
So we have a question coming in. This one's about, and you guys can ask questions about Title I or Title II. We just wanted to be sure to catch your questions as they come in, so we broke it out this way. So we have another question about reunification, and the question is that what if the youth does not wish to be reunited with their family because of the connections or because of however the youth is feeling? Every situation is different. Will their interests and wants be taken into consideration? So this is going to be dependent on other laws and other current policies. So the Family First Act doesn't impact the other laws that have to do with this. There is a new law that is currently being implemented. It was passed about a year and a half ago, and it's called the Strengthening Families Act. And in that law, it actually gives youth age 14 and older a right to participate in their case planning. And that means that they must attend their permanency hearings and their case planning sessions. And not only that, but they also get to invite two supportive adults of their own choosing. Maybe it could be a coach that they are really attached to, or perhaps a teacher or a pastor. It could be anybody. And those two adults that are helping out the youth and advocating for them are totally, completely up to the young person to decide who those two adults are. And then the judge is also going to ensure that the youth has their opinions heard in the courtroom when they're deciding their permanency plan or their reunification plan. So that would be a situation, I think that's answering to this question, where a youth would be able to verbalize what their opinions are regarding their own case plan, and they get to authentically participate in the case planning process, since it is all about them, right? And so that's a separate law that already went into law. So now that's going to be implemented in the state. So if the Family First Act passes, then the foster youth impacted, every foster youth will be impacted by the Family First Act. So any foster youth that is removed from their homes and placed in a family foster home or a congregate care setting, if they're 14 years old and older, they will have an opportunity to say, I don't want to be reunified with this, and here's my reason for that, right? Or I already experienced a congregate care placement like this, so I don't want to be placed there. Is there any other option? Like, what are my other options? So I hope that answers your question. Let me check.
And just
Oh,
to
go ahead.
reiterate that,
Yep.
this law does not override any other laws. Many states have case planning models that have the youth at the center, and so the youth really gets to decide with their team the direction of their case planning, and that's still going to be the case. The youth voice is still going to be centered. This just adds on the state to do as much as they can to ensure that a youth is being placed in the most appropriate placement that is good for them and they get a voice in that.
Thanks, Chris. Demetrius, did you have anything to add?
Nope, Chris covered that aspects of it.
Good. Okay. Yeah, just let me know if ever you want to jump in. I have a couple other questions, and feel free to keep sending in questions and comments and concerns as we go through the list. So I have a question about assessments. So are foster youth assessed before being placed in congregate care settings? So the Family First Act does address assessment, and it includes provisions that, one of the provisions is that foster youth must be assessed with what's called a functional needs assessment using a validated assessment tool that is age appropriate and evidence based. So, what does that mean? That means that this isn't an assessment tool that a caseworker just wrote on a coffee napkin, that morning to assess the foster youth. It's not something that's written on the back of an envelope. This is a tool that researchers put together. They crafted the questions for specific age groups, so there's different tools, and they tested it, and they made sure that it was an appropriate assessment tool, right? And so every foster youth will have to use one of these appropriate assessment tools, and it must be completed by a qualified, independent individual. So it must be completed by, like, you would think, a doctor or a practitioner who has a degree, who learned how to do an assessment formally, right? And they are licensed. And what they mean by independent is that they are not a caseworker. They do not work for DHS. They are not affiliated with DHS. They are independent in a private practice. And then they have to do this assessment in conjunction with a family and a permanency team. So it's not just one-on-one with the child, but there's more people involved. And they have to do this in conjunction with any youth who is 14 years old or older, and that's reflecting back onto that law that we just talked about. And these assessments will determine what is the best placement setting for this youth. So if the placement setting, if there's a congregate care setting that only offers a specific service that a youth needs, which they will find out during the assessment, then that's the only time that it's appropriate for the youth to be placed in that congregate care setting, right? If there's no other way that they can access that service that's offered in that congregate care setting. And so that's that question about assessment tools. Let me just double check the question thing. All right, we have another question. How much federal funding do states currently receive for group home care? Are there current restrictions on length of stay? That's a little bit more complicated information to find out because the federal funding for foster care is even really hard to nail down, right? Because it's so the federal government contributes to foster care expenses, including congregate care, as well as states, right? And so, well, Sarah, I can take you off mute if you want to kind of elaborate on this more. Hold on, let me take you off mute because I don't actually think I know what you're asking. Can you hear us, Sarah?
Yeah, I'm here. Thanks, Jamie.
Okay.
Yeah, one of my thoughts, because I know that there are current conditions, at least in California, around length of stay in group homes, and that has to go through what they call a utilization management process after a certain length of time. And I was wondering, since this is putting, I think, a 2-week or 10-day, I can't remember what you said, limitation on group home care for federal reimbursement, if there's already restrictions. Because I had a feeling or a sense that perhaps the federal funding is not currently indefinite. Perhaps there's already some sort of requirement or restriction on length of stay, and this might just be shortening it. And I was curious about how much.
Well, there's a lot of different time constraints on in the Family First Act, so I just want to be sure I know which one you're identifying so I don't get it mixed up with another one. Where did you find the 10-day one?
Oh, I think it's actually in the draft.
Oh,
I'm not sure that you noted it in this webinar. Sorry, this is like my third webinar on this.
yeah, let me look at the draft. Sorry, you guys are all going to see my screen for a minute.
Yes, it's, I think, the first 2 weeks.
Yeah, so in the first 2 weeks, that's basically saying that in the first 2 weeks is when an assessment has to be done. So if a child is placed in a congregate care setting, they have to do this assessment that I was just talking about within the first 2 weeks of living in that. Like they cannot remain in a congregate care setting longer than 2 weeks for no reason. Or is it 30 days? Oh yeah. Does that make sense? That's right.
Yes.
So, so if there is a child remaining in a congregate care setting, then the federal government says, sorry, we're not gonna give you money for that now because you missed your 2 week mark for that kid. So they're gonna have to either move the child into a more appropriate setting, or they're gonna have to find funding somewhere else, which I don't know where they're gonna find funding for this. Somewhere outside the government to keep that kid in that congregate care setting. Because the whole point is that the foster youth should remain at home or in a kinship placement, right?
Right. And I think my question is, prior to this act, were they just sitting in group homes indefinitely without some sort of assessment proving medical necessity?
Yes, it happened a lot actually. There were a lot of kids experiencing congregate care and not receiving services at all. They were just there because there was no other placement option for them. And so, and then there were lots of children that were remaining in congregate care for really long periods of time, like way longer than like there are kids that were staying in for up to 2 years or until they aged out. And that's not what congregate care was meant to be. And so Congress is saying, okay, like we need to crack down and make congregate care what it's supposed to be.
Thanks, Jamie.
Thanks, Sarah. Okay, I'm going to put her back on mute. Any comments, concerns from Chris or Demetrius while I pull up the next question?
Oh,
I had another comment about, so I just pulled up the draft that you guys saw. So that draft is actually my notes from the meetings that we were discussing all these different issues like congregate care and that kind of thing. And I'm happy to send out, everybody else is distributing their notes, so they're not private. So I'm happy to send you all on this webinar my notes, but know that this is not a draft coming from Capitol Hill. These are just my notes from meetings and from briefings on the Family First Act. So, and as far as I know, this has not been changed at all because we haven't had any meetings since since then. So yes, I am happy to send those out. And just remember, at the very beginning, we talked about where the Family First Act is in the policy process and why there isn't a draft of the bill out yet. And that's because it has not been introduced yet. So once it gets introduced, everybody has access to the official language, right? All right. Just so you guys know, this is question and answer time. We have plenty more time just for you all to ask your questions, raise your comments and concerns. If you want another example to go through any of the titles again, if you are confused about something, now is definitely the time to bring it up. We are able to stay on. I had this webinar scheduled to go on until for an hour and a half, just so we could provide as much discussion as you guys needed. And so we will keep taking questions as they come in. So we just got another question. Will this webinar be made available for those not able to attend? Yes. So at the very beginning of the webinar, before I press record, I announced to everybody that we will be recording the webinar and sending it out to everybody who registered and may not have been able to attend, but also to folks who maybe forgot to register, didn't register because they didn't know that they could still get the recording. So we are doing a recording, and you will be receiving a recording even if you are on the webinar right now tomorrow through the GoToWebinar system. And you are free to share that as well. Once you get it, you can share it to your networks. Let me check the chat. All right, so I have another question about congregate care. The question is, well, I actually had a question about services. I'll jump up to Title I real fast. So I had a question about services and what kinds of services are we talking about, right? When we talk about services provided, services. And so I made a slide in case this question came up again. And I pulled this language straight from my notes from the meeting. So when we talk about the services that the Family First Act is now providing, those prevention services, we're talking about services that are trauma-informed and following the evidence-based criteria used by the California Evidence-Based Clearinghouse for Child Welfare. So if you just simply Googled that, there's a ton of information in there about what that criteria is and more specifics. And any service that any state or jurisdiction is saying is a prevention service that they would like federal funding for, then this service must follow this criteria, right? It must be trauma informed and it must follow the evidence-based criteria. So another thing about services is who is eligible for these services. So those who are eligible are candidates for foster care who are identified by the state as being at imminent risk of entering or re-entering foster care. So you can think about our examples, like our child who was at the hospital with their parents, or you can think about our child who was homeless with their parents and the educator discovered, or you can think about our teen who was having behavior issues and getting in trouble with law enforcement. And then others that are eligible are also pregnant and parenting youth in foster care, and parents or kin caregivers, so again, aunts, uncles, family members, kin caregivers of children at risk of entering foster care. These are all the different types of groups that are eligible for these prevention services under the Family First Act. And to help you think about what kinds of services those are, those could be substance abuse and mental health services. Those could be substance abuse prevention services. They could be in-home or parent skill-based services or education. That could be family therapy. That could be, there's just a range of, there's even emergency services, kinship navigator. There's all kinds of different services that are mentioned in the Family First Act that would be available to folks. Let me navigate back to our slide. Not that one, this one. So I think this might be our last question. So if you guys have any other questions, I'm going to answer this last question that I have, but while I do, be sure to type in your questions or raise your hand so that I know if you do have another question following up. Otherwise, after I answer this next question, if I have no more, then we will turn it over to our final slide about taking action. So our last question is about congregate care. And it is, what about youth? What about youth who prefer a group home over a family foster home, right? So my answer to this is the national trend that is surfacing is that foster youth prefer congregate care placements when they were able to establish meaningful relationships, when they had access to quality services, such as services for pregnant or parenting teams or transitional living services. And they also enjoyed these placements when they received the mental health services that they only had access to through congregate care settings. So for these reasons, the Family First Act offers financial support for congregate care settings that include these components that foster youth said they like. And, Chris mentioned how foster youth were informing Congress every step of the way to help them, paint a picture of what they wanted the congregate care settings to look like. So this implication is that the Family First Act will not be offering federal funding to congregate care settings that foster youth have stated that they don't like, such as Chris mentioned, settings where abuse occurred or settings that do not offer services that foster youth need. So I hope that clears up that question. The hope is that we are creating congregate care settings that foster youth have said they like, and we're creating better oversight so that foster youth don't have to face misery or abuse or anything in these other congregate care settings. So I don't see any more questions coming in. Chris or Demetrius, did you guys have any final thoughts about the Family First Act before we turn it over to action items?
No, I have not.
I don't have anything.
Okay, good. Excellent. So this is going to be our last slide of the night. Don't forget, you guys always have access to me. You can call me anytime to ask any remainder questions if you couldn't think of them. But for this slide, I think I'm turning it over to Chris.
So now that you've learned a little bit more about the Family First Act, we want to tell you about some ways that you can activate for Family First. Like we mentioned, it's in the process of becoming a bill and it's just being discussed right now. So you really need to engage with it in order for it to actually become law. So first and most importantly, learn everything you can about the Act before anything else. Make sure that you know the facts. If you're confused about anything, call or email or Facebook Jamie immediately. She is very responsive and very knowledgeable about the Act and everything that it entails, and it's really fun to bother Jamie.
Just a little.
Thanks, Chris. Um, yeah, so like I said, and like Chris said, I'm available anytime. Jamie at fosterclub.com. You can also call me. My number and all my contact information is on the website as well as my Facebook link. I'm on Facebook all the time just for this stuff. So I'm available for you, at any time. So speaking of Facebook, actually, you can elevate Family First on social media, and I very much encourage you to do so because a recent survey of policymakers and members of Congress found that as little as 10 comments on social media on a specific topic will actually get that policymaker's attention, right? So if you tag your Congress member and then you tag Family First and then you make your comment and then you get 9 other people to do it, then your senator is easily, I mean, for some senators, it's as little as 5, right? For a lot, even just 1, because other senators will be like, oh, you got a comment on your Facebook about Family First? I did too. Our constituents must be talking. And so I just wanted to share with you kind of what the members of Congress, how they really are active on Facebook, probably as much as I am. And so they do get a lot of feedback regarding their constituent views on Facebook. So I very much encourage you to do Facebook as well as Twitter. I don't know my Twitter login, so don't try to contact me through Twitter, but definitely contact your senators through Twitter. And if you don't know any of that contact information, you can actually visit this link in yellow, https Google. I shortened the link because our link was way too long, but that'll take you to our website. And I actually made a page all about contacting your senators and how to figure out who your members of Congress are and how to contact them. And then finally, what I wanted you to do before I give it back over to Demetrius, we did write a letter, a Family First letter. It's a sign-on letter. So out here in DC, most nonprofits draft up what's called a sign-on letter, and they and advocacy organizations all get together and sign each other's letters, and then they send that letter into members of into Congress, right? So it's the same letter, but all these different advocacy organizations are saying, yes, I agree to this. Yes, I agree to what's said in this letter. So we wrote a letter for foster youth to sign on to from all across the country, and that's on our website. And I very much encourage you to go read it, see what you think about it, and definitely sign on if you agree to it, because the more sign-ons we get, the more of an impact we're going to have. So I'm going to now turn it over to Demetrius to talk about contacting your senators and how easy it is and how fun it is, right?
Right. Thanks, Jamie. Just to piggyback off what Jamie mentioned earlier, you can contact your senator or elected official directly. We have the link above attached to this slide. You can call, email, or write them a letter. I recently wrote my senator a letter about the Family First Act surrounding the importance of such legislation, and I was pretty surprised to receive a response relatively quickly. You can I also want to share and highlight some key points when contacting your senator via email, phone, or by letter. The first thing you want to do is establish that you are a constituent of theirs within the beginning of the conversation. The reason you want to do this is because our elected officials have tremendous time restrictions, and if you are able to establish your constituent early on, you have their attention. At least that's been my experience. You want to identify the issues and concerns such as foster care, Family First Act, etc. I would also encourage you to inform your elected official of your thoughts and why you have these perspectives. Include your personal experience to your objective or your issues surrounding the concern. For me, I found once you establish or provide personal experience, you establish your expertise and credibility to the cause, and then they're more inclined to take what you're saying attentively. And finally, I would strongly, strongly encourage everyone to maintain an open dialogue for follow-up conversations with the elected official or his staff personnel by leaving your contact information or helping his staff or her staff facilitate a follow-up meeting. Um, that has been a wonderful avenue that I've traveled down. I've been able to have open dialogue with my elected official regarding this particular matter.
Yeah.
That's all I have.
Thanks, Demetrius. Yeah, if anybody needs help with that kind of stuff, I try to put as much guidance on our website as possible. But if you need personal, like one-on-one help, Demetrius wrote a letter and sent it to me first for feedback before sending it on, and so we worked together on his letter, and it was so great. And then he actually allowed me to keep his letter on hand as an example to share with others who are interested in writing to their member of Congress, right? And so I'm definitely happy to share that with you to help give you ideas or, some structural context in case you want to write a letter. So visit fosterclub.com to find out more about the Family First Act, to find our letter. We'll put up a recording of this webinar on once it becomes available tomorrow. You'll find your senator, contacting your senator's information in there, and then you'll also find my contact information for anything that you might need. So other than that, thank you so much, Chris and Demetrius, for helping me out with this. It's been really fun.
Thank you.
Okay, I think we're done.
Have a great
Have a good night.
You as well. Bye, everyone.
Bye bye.